Hi all, today we are going to discuss about the cardiac veins. So first of all, the cardiac veins, based on the pathways they are circulating to form these veins, we have divided this into the three sets. The first set is the veins that is related to the coronary sinus, and the second set that is the anterior cardiac veins, and the last set that is a small cardiac veins. First of all, we are going to discuss about the cardiac veins, which is related to the coronary sinus. So, first of all, we have to understand what is the coronary sinus. Coronary sinus is actually an opening into the right atrium of the heart, especially in the posterior wall, for the entrance of the cardiac veins to drain into the right atrium. Then, along with the veins, the superior vena cava and the inferior vena cava blood, they travel into the right ventricle, then into the pulmonary circulation. Okay. So this coronary sinus is actually a 3 to 5 centimeter long length, and it is a short structure. So where, as I said, it is a wide venous collector, and here we have the opening for this venous coronary sinus, which is called as the ostium sinus coronary, and also like the other pulmonary valve, or we will consider the aorta, they also have valve, and that valve is called as the valvus sinus coronaria. Okay. Now, this sinus drains blood from several branches which comes into the coronary sinus. So now we are going to discuss which are the branches. Remember, these branches which we are going to discuss now is actually the coronary sinus branches. I mean the blood vessels which is joining into the coronary sinus, the veins. Not this is not the anterior cardiac vein or not the small cardiac veins. So the first one is the great cardiac vein, and this great cardiac vein and the one which I'm going to explain, the middle cardiac vein, both are actually originating from the apex of the heart. Okay. So first it is from the area of apex of the heart, and this vein actually passes along the anterior interventricular septum. So you know what is the anterior interventricular septum? This is the septum which separates the right ventricle from the left ventricle. This ventricle, this septum have on the external surface a groove which is divides the right ventricle and the left ventricle on the external surface of the heart, which is called as the sulcus. Now remember, this vein, this great cardiac vein from the apex of the heart runs through this sulcus. Okay, and then they turn into the left and enters the coronary sulcus. Okay, now this vein actually, when it comes to the left side, how they now goes to the coronary sinus, they are in the left side. What they will do, these veins are starting from the anterior interventricular sulcus up to goes up to the apex region, then they loop around to the left border of the heart, and they goes to the coronary sinus along the posterior surface of the heart. Okay, posteriorly they come to the surface of the heart. I will show you the pictures at the end of the video. And then the great cardiac veins actually take some branches, and that branches is called as the vena ventricularis or the ventricular veins. These are the small veins which is originating from the right and the left ventricle. So these veins are drained into this great cardiac vena, and also veins from the remember, left atrium, not the right atrium. From the left atrium also there is small branches, they will collected, that is called as the vena atriale, and these branches comes and joins to this great cardiac veins. Okay.